The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Welcome to the Connecticut HMIS Changes in Response to COVID-19 webinar. I am Amber Freeman, the Training and Technical Assistance Coordinator with the Connecticut Coalition to End Homelessness. I'm going to start us off with some housekeeping. All of you are muted, and this recording is, this webinar is being recorded. We will send out the link to the webinar at the end, as well as the webinar slides. Also, we will be taking questions at the end of the webinar, so please just enter your questions inside of the questions box. On today's webinar, we have Linda Casey, the Director of HMIS and Strategic Analysis with the Connecticut Coalition to End Homelessness. We also have James Buckley, the VP of Research with Nutmeg Consulting. And now I'm going to have Linda start us off.
Well, good morning, thank you, Amber, and good morning, everyone. Thank you for joining us on this webinar to hear about the changes we've made in HMIS here in the state of Connecticut to accommodate all the activity circulating around the COVID-19 response. And so you'll find through this webinar that we're collecting data about the COVID symptoms and testing results. But the question that I want to start with is, why are we collecting this data? And I want to highlight really the short-term benefits as well as the long-term benefits for why we're doing this. So as most of you have probably heard, there is, as we speak, an effort going on to increase the amount of tests that are going to become available in the state, and really a statewide push to test everybody more than once as a way to really understand the prevalence and the actions that need to be taken as relates to COVID. So as this testing becomes more and more available, and as our homeless population has the benefit of having multiple tests happen, we want this data to allow the providers the ability in the system to quickly enter those test results and be able to view them very quickly as well. As a lot of you know, folks have been split between shelters and hotels, so there's different ways, different lists available, but we want to centralize that data so people can actually see in their population for their location exactly who's tested, when, and what the results were. As we just mentioned, the alerts for testing positive is going to become important because people will want to see quickly at a glance, hey, I want to know who's positive right now in my environment, because that's going to help me understand how to do anything with that from a location perspective, which leads me to the next point. The ability to track the symptoms, and we know they're changing from the CDC, and we'll update the system accordingly as the CDC changes them. But right now we have the most current symptoms available to select from. But that's going to help you understand, and as you already are doing this perhaps, but we're going to centralize it in our system to manage the isolation protocols or the quarantine locations wherever the person, depending on what their symptoms may be and what is needed at the time. And as you also know, we are having an effort statewide to have the CANs, the Coordinated Access Networks, work closely with the local health districts and departments to obtain test data that may be coming from hospital systems and from other labs. So we're working in a variety of ways across the state to make the testing data available, and now we have a place for it to be centrally stored and searched on and used for management of the client. So those are really the short-term immediate benefits. But from a longer-term perspective, you think about the value that this data is going to have. We're going to be able to analyze as a system, as a state of Connecticut, how do we do from a disparity, from racial disparities or other social inequity disparities, we will be able to see how our system functioned in this crisis. But having the centralization of the data is really going to help us, as we've talked about, facilitate the management of the clients with COVID-19, whether they're symptomatic, asymptomatic, or have test results. And also, finally, the long-term benefits when we are done with this, and as we go through this whole COVID-19 pandemic, we really want to have, and we will be able to have now, the ability to see that overview of how this whole virus has really affected our community as a whole, and also, again, as we talked about, being able to slice and dice the data based on how our COVID response was. So those are the benefits of why we're tracking the data. And moving on. So just as a high level overview of what data we capture, James will certainly go into this as the lead developer for Caseworthy, which is the HMIS tool we use. But anybody who has an open enrollment in our system, whether they're emergency shelter, permanent supported housing, PAP, PSDAT, whatever open enrollment they might have, you will be able to capture and collect the COVID-19 symptoms and testing data on that individual. We have, as you know, been tracking the clients via Smartsheets, the DOH effort to capture the Smartsheets, the people who have been transferred to hotels. And we have now imported those clients into HMIS. We'll get into more details about what that's going to look like for you, but just so you know, the current data is now all in HMIS. So any changes to new clients or to current clients will be imported at regular intervals, but just want to make the point here that it's not an automatic data feed from the Smartsheets to HMIS. So we'll get into more detail on that. And we're also going to be using HMIS, as I mentioned, to cover all COVID symptoms and test data. So moving on. Smartsheets, as we talked about, the Department of Housing set that up as a really efficient way to track who was moving from shelters into the hotels that were being established at the time. DOH has asked us to share this, that they would like you to continue to use the Smartsheets to enter the exit dates and the exit destinations, as well as any new hotel clients that you add until this hoteling period is over. I know we originally thought that the hoteling period may be over at the end of this month. If that extends a few more weeks, what have you, but we want to honor DOH's request to say, just from the housing perspective, continue to use Smartsheets to enter those exit dates and, as I mentioned, destinations, or if anybody new enters a hotel, they want you to continue to use the Smartsheets for the short term. What I'd like to mention here is that, as we have heard, there is likely going to be perhaps a second wave in the fall or winter, and perhaps even a third wave if this follows certainly what the Spanish flu did. But what we'd like to know is that the system is now set up to capture that new, if we have to go back to hotels or we have other locations, alternative care facilities, what have you, we now have the structure in HMIS to be able to track that. So we can close out the use of Smartsheets for this wave, but we'll be able to use HMIS as a centralized system moving forward. So I want to make that clear. And then just to reiterate, if you've already entered a client as part of the hotel stay as of yesterday's date, you will see the data currently in this system as James walks through in the demonstration. And just to put people's minds at ease about the privacy and security standards about capturing COVID-19 data in our system, I just want to reiterate and highlight some of the privacy and security standards that are really offered up. And this does not conflict with Connecticut standards. This is in fact completely in line. And I highlighted some of the key features there, that because the provider believes in good faith, the disclosure is necessary to prevent or lessen a serious or imminent threat to the health or safety of the individual public, which is currently what we're experiencing in COVID-19, it is applicable to have this data captured and shared within our system. The information is shared with a person reasonably able to prevent or lessen the threat, certainly true with the providers and our entire homeless system. And under current emergency circumstances, disclosing the COVID-19 status to anyone offering services to a client really meets this standard. So just again, there's more to this. I wanted to highlight this, that this is in fact something, this is why we are sharing this data, because of truly protecting the public, the health of not only our clients, but also just from a public health perspective, being able to make sure that we're doing the right thing and being able to know who is testing positive and what measures are being taken. So if you have further questions on that, certainly reach out to me. And before I turn it over to James, I just want to reiterate that this is new. A lot of what you're going to see, we're really kind of pushing Caseworthy to the limits here. These are not the standard flows that you've been used to seeing in this system. And part of what our design approach was to really make this as fast and as easy and as quick as possible from a user perspective. We really want to focus on the end user experience as they go through entering the COVID data. And because this is so new, we realized, this may be something a little different. We hope it's going to be so intuitive that you will not have challenges. But if you want to provide us feedback and say, hey, as you go through this, I have some ideas about how we can make this better, don't forget, we'd love to hear from you. And because we have the release bin as a feedback mechanism, we'd love to Just a reminder that this resource is available to you. I have included the link there, the URL, to enter any comments. And I want to take this moment to say, for folks who may not remember, help desk, the Nutmeg help desk is really meant for if you can't log in, if you have challenges, something more technical assistance. But our feedback loop and the release bin is really for future suggestions, things you can improve the product, and go from there. So without further ado, I will turn it over to James for the demonstration.
Great. I'll just need presenter permissions. And I'll need a presenter permission. So if you right click me and grant me that.
James, you have permission to advance the slides.
Oh, you're okay. I was going to share my screen.
Okay. Now you're going to do that. Okay. You would have to hit the screen sharing on your left side of your.
Yeah, I think there we go. There's nope. I need permission. You have to right click me and grant me permission.
1 second. All set.
There we go. All right. All right. Can everybody see my screen? I hope.
Yes.
All right, great. All right. The COVID screens are going to be available on all roles in the system. So no matter what kind of program you run, you'll be able to add COVID-19 data. In addition to that access level of the menus, which I'll show you in a moment, all roles will have a client-specific dashboard with these new alert systems on them. They contain the last two results for COVID-19 testing and for COVID-19 locations. So you'll be able to see instantly when you load a client, look at their dashboard, okay, this client at this point was negative, and at this point being positive in their COVID testing. Additionally, you'll be able to see their current locations in the system. It'll show the last two locations to see kind of the travel of the client if you have to move them from location to location. Again, with their housing status, whether isolated or quarantine. These dashboards can be clicked on to drill down to that specific client's data as well. The majority of the time, you'll be working with clients with COVID data. You'll look at the left side menu, COVID-19, available again on all roles, and you'll see three choices. You see COVID-19 housing list, which is going to display all open enrollments within your organization. So every client who has an open enrollment will be listed here. It's kind of a big picture view of the data, and we're going to drill that in a second. You'll also see links to the current client's medical information for COVID and housing location information for COVID. So you can either handle your entire list of active clients or drill right down quickly to this current client's medical information or housing location information. I'll go ahead and click on COVID-19 housing list. Let's go look at my current logged in organization, say, okay, show me everybody in this organization. In this case, it's our main kind of test organization, so a lot of testing data. This list can be filtered in a variety of ways. Many of you are used to, such as client ID, first name or last name. In addition, you can sort by COVID-specific information, such as the most recent testing result status, negative, not tested, pending, and positive. So if you need a list of positive people, you can just filter down and then export this list like you can in many other screens in the system. And just a reminder to export list items, it's always the right corner teardrop, Excel export. So if you need to work with your list in some way that outside of HMIS, you can do that for simple reporting or just checklists for our clients. Our results are pretty self-explanatory. We have our client name and ID, the program that they're currently enrolled in that's open. And if a client is enrolled in several that are open, you might see them once or twice on the list, but the data still is specific to one specific client. You'll see their housing location, in this case of Best Western in Hartford, whether they've been isolated quarantine, in this case they haven't, any testing result dates, and then the results of that date. And we'll we'll come back to this in a minute. This is our special COVID program enrollment, and we'll talk about that in a second. Client information, this is basic demographics along with contact information. So if you click on that, you'll get a pop-up. So the basic demographic information at the bottom here, cell phone, home phone, and email address. We kept this screen nice and simple and short, so it loads quickly, and you can get the vital information updated or reviewed. Next, we have our COVID-19 information. This is all the medical information right now in the system that relates to things like symptomatic. Yes, they have symptoms, or no, they do not. If they have symptoms, you'll see a list of symptoms that we've taken from the official list. If you check on them, you'll see that a date symptom started field is available to be filled out. You can select as many as you need to. You'll notice that there's also, unfortunately, if client is deceased option to accord a date of death if that is an outcome. And below here we have a list of service needs. This is based on the list that we imported. So you can select off one or several of them. And below here are, if there are any existing testing results, they'll already be listed here for a quick look. You see here we have positive results and then some negative testing as well from different lab locations. At any point, we can go ahead and add a test location or testing incident. Maybe you refer them only, or maybe you've got them tested and are recording the information. The results of that test and result date. It'll be instantly loaded back into the main drop-down here. You can also edit tests in bulk to update any statuses, or results, or dates, or make any corrections. And that's pretty much it. We'll keep that updated for that COVID information as we get new symptoms or as new requests for data are collected. We also have the housing option to track which hotel, motel, or other property they are occupying. Notice you can add several sort of a history of housing. So this client may have gone to 2 or 3 different motels. You can track each one and what was happening in each one. Click on Add New Housing, which you choose from our list of preloaded providers that was provided to us, which may expand over time, whether it's a family or an individual, room type, room number, whether they're isolated, quarantined, or no action needed for, we're calling this medical housing status for now. They entered that housing. And if they exit the housing, there's an Update Exit button, which will just present the date. I haven't hit save yet, so I'll add that new housing listing. All right, and that client now has their housing information updated. We also included a case note link that you're very familiar with already. If you do case notes for clients, it's the same standard one you see on any screen. You can add as many as you want. Just a quick way to get there quickly for your entire roster of clients. So the reason we show all the clients enrolled is because it's a quick way to see your entire group of people in your organization. But some clients may come in and they might not be traditionally enrolled in any of your other programs, emergency shelter, or maybe they're an outreach client and haven't been enrolled yet in the outreach program for various reasons. We do offer as well a client and housing enrollment for COVID that is a very minimal intake process. It will start a standard workflow, abbreviated, so it's a bit on the shorter side to make sure it's simple and easy. You have the information here as you normally would in any other HMIS workflow. You have the ability to add other family members if you so wish to get a full idea of who's in the family. The release is already pre-populated. You can update it if you need to, but you can mostly just hit save to go right through it. So for each organization, you'll have your own special COVID program, starting with the words COVID. If I have an example program with my example organization. Your provider will be your typical provider for wherever they're looking. Provider represents physical location, so if you're at an emergency shelter doing this, you might choose emergency shelter. It's wherever you're actually doing this kind of intake. You have the option to enroll those members, those family members you added before, into this COVID enrollment if you so need to. In this case, it's a single, so I don't have to. And then you'll see that the basic COVID testing and status items are already shown right on the workflow to quickly add and update this client as needed. Same exact screens as I showed you before. All right. And then new client will be added to our overall COVID list. Clients who get the special COVID enrollment will get a special button right here where they can quickly exit out that client and collecting minimal data except what we want for exit destination. In this case, we'll use Mercy Shelter. Pardon me. I clicked a little too fast. And if all your standard exit workflow, ask the question, hit save, where the destination is. Small bug there, I think. And you provide an exit date from that enrollment. And you're done. So again, at any time, you can go back to your list, view your current clients. You can also jump directly to this specific client's medical information and housing information. Housing information is, again, pretty simple. I showed you before, housing provider, location, room number. That's really it.
All right. Thank you, James.
We'll take any questions.
Yes, we will go into questions. If you all can just type your questions into the question box and I will go over some questions. We have a few so far. Someone is asking, who is supposed to enter this information? Is it for shelter staff, for their clients, or is it for unsheltered individuals?
So anybody who is dealing with entering data for a client, whether you're shelter staff or if you contract, well, no, it has to be someone who has HMIS access. So anybody who has HMIS access who is in a position to be entering data, whether they're working with a local health department or they have, maybe the client has come back and told them they just came back from the hospital and they have, test updates. And it's anybody who has access to the client record.
Great, thank you. Another question is asking, what about clients that have recovered from COVID-19? Is there a place to enter that?
That's a great question. I think part of what we're looking at while we're capturing some of these dates are a lot of that 14-day time frame. For example, if you've been quarantined after you've had it, we could run reports and actually see, you can filter by people who have tested positive and actually have the 14 days met with no additional symptoms. I know, James, if you want to add to that.
I think that's a great question. Yeah, we can calculate and display when that period is over. It's something we don't currently have, but it's easy enough to do. And we should also really consider adding it to the view. So I think it's something I'll take a note on.
Thank you. Surprisingly, we do not have many questions. So if more of you guys can input your questions, that will be great. We have another one. Okay, I asked and here they are. Someone is asking if we're looking for staff to go back and enter the data or just enter the data moving forward.
So that's a great question. I would say just from a data perspective, we'd love to have all the testing data in there. That just makes the ability to do analysis so much richer. But saying that, I understand that people are maxed out with their current demands on what they're doing to maintain the staffing right now. What I'd say is that would be a great thing to have. I can offer up to, depending, I don't really know how folks are capturing that. I think it's varied across the different cans. If you have the data that is in a form that you can hand off and we could, find additional resources to enter that for you, that would be something we can explore as well. But yes, we'd like to get all the COVID data that has been, any test results and anything like that into the system, but we don't want it to be a burden on you. So again, if you have that information that you can pass off and we could have a third party enter it, we'd be happy to do that.
Okay, and just for a little clarity on the exit date, there is a question, is the exit date the end of the 14-day window, or is it the exit from the program?
The exit date is actually the exit from the program.
I want to just mention that there are two kind of exit dates in the system. There's the program exit date, which is what you're used to using, and that's what Linda identified. There's also just a housing exit date where you leave that particular hotel or motel, and they may be the same day, or they may not. So there's two bits of data there.
Okay. And then are you only entering this information for individuals that test positive, or do you enter for clients that test negative as well?
Oh, definitely any kind of test, negative, positive, those, anything between that you're waiting for, as James demoed, people who have been referred and you may be pending the results. So we're looking to have the full scope of people who have not just been tested positive, but also those who've been, the results come back negative.
Okay.
Because that could change overnight.
And just for clarity, as far as testing, are you also requiring individuals to upload the proof of their status, or is it also just by what a client reports?
That's a great question. By uploading proof of the status, I'm not aware of anybody having paper proof of that, but if that exists, that could be, and James, correct me if I'm wrong, but that could be just uploaded into the client's record as part of the regular file upload. But that's not being required right now.
Okay.
Correct.
All right. And are there any consequences if the data is unable to be entered?
I'd love some more detail around that question. What circumstances are you referring to that the data would not be able to be entered?
Says that they have not been able to identify who will be doing the data entry for people who did not come to the shelter. And we're not keeping track, so they don't really know the facts.
Okay, I would really recommend whoever that question applies to, or whoever entered it, could you reach out to me just offline and we'll have a conversation, because we really, the more data we get in the system, as I mentioned, the better we are as a community in understanding how we're responding. So it's really important to make the effort to get the data in, and if you need help with that, we'd like to get creative in terms of how we can help you to get that in there. So the specific question is there any penalty, or is there any, I can't recall the word you use, but the question is, right now we don't have that. We're trusting that folks will want to enter this data, and we want to encourage folks that just remind them how important it is to get this data in. And again, we're offering our help to help you find a solution to get that data in there.
Okay. One second. All right, that is actually the last question that came through. So thank you all for attending this webinar. Again, this webinar is being recorded, so the recording will go out, as well as the webinar slides, as well as additional information. So we will send that out. You can ask additional questions, and we'll send all the information out. Thank you so much, Linda and James. Do you have any additional information?
I just want to thank everyone for your time, for
I'm good.
joining today. There's a lot to digest, so please feel free to reach out to me directly with any additional questions. A reminder, if you see things and you're like, hey, as you start using it, as I mentioned, the release bin is a great way to share anything that you think would make the system better. And we just hope you you find this as an easy way to enter really important data. So thank you.
Great. Thank you.
Thanks, everyone.